Thank you. Welcome board members and advisors to our December meeting. Good to see you all, some in person and others online. I think Linda's going to be a little bit late, and I think that Professor Griggs is also going to be a bit late. So could I remind all board members that we're being live streamed to allow public access, and also that the meeting is being recorded and will be available for subsequent viewing online. So I'll pass to Stephen if you could give the Sedran apologies.
Thank you, Chair. We have apologies from Jeff Ace, but Valerie White here as Deputy, Nick Morris, and Marsali Craig was going to be Deputy, but she's unable to make it, unfortunately. Joanna Campbell and Karen Hunter is online, deputising. Jane Morrison-Ross, and we have Rob Davidson here in the room today. Dawn Roberts, no substitute today. John Cairns. However, we have Chief Inspector Dean Little joining us online, and that's the official apologies. Thank you.
Excellent. Excellent. Thank you very much. Okay, so we'll move on to item 1, which is the draft minute of meeting of the partnership on the 1st of September. Are we happy to agree that it's an accurate record? Nobody indicating otherwise? No. Good. Okay, so that's agreed. Item 2, Community Planning Action Log. Stephen, over to you.
Thank you, Chair. Just a few items to update on. So, number 6 and 8 in the action log, which is the Community Transport Update and Youth Matter stroke 10,000 Voices. So there has been progress made on both of those, but there's a more detailed update in item 8, so if it's okay, we'll come on to that then. Other areas just to update on. Item 17, there was a request to develop a community planning handbook. So we have written out to all the leads of the plans and strategies which contribute to the LOIP and the partnership, and they're going to provide us with some detailed information to get that going with a view to getting that agreed in the first part of 2024. Item 16, we were hoping to have the Workforce Summit presentation today. However, Lead Officer Lynn Burgess is actually on leave and there was no one else available to do that, so we're going to roll that on to the first meeting of 2024. Number 20, it was agreed following feedback through the Community Planning Senior Leadership Team that the compact agreement with the third sector, that it would be better to pause that work until the new Chief Executive of Third Sector, D&G, had been appointed. And it was also noted some of the winter pressures across partners and with a view to starting that early in the new year as well. Item 21, we spoke about potentially raising concern with Scottish Government over vaping, and Valerie White's kindly working on an evidence brief with Public Health Scotland, which would be used to support a submission to Scottish Government, and we can communicate with co-chairs when that's available. And also later on in the agenda, it was the late item, again Valerie's team have prepared a suggested response to the UK consultation on vaping, which we're keen to get the board to endorse before that gets sent off. And finally, item 22, it's quite a lengthy update from Jim Brown, the Head of Education, just about certainly agreeing to invite Third Sector, Dumfries and Galloway, to join the exec group, and also an update on the position with the Family Wellbeing Fund, which is as detailed on page 20 and 21. And I think that's the main items really I wanted to cover. Thank you.
Great, thanks very much, Stephen. Members, any comments or questions on the action log? Not seeing anybody. Okay, so we're happy to agree that we're moving on with those actions and covering all the key issues. That's great. So moving on to item 3, which is a presentation and discussion on alcohol and drug strategy 2023 to 2026. And we've got Penny Halliday and Jackie Davis online to do the presentation.
Sorry, Jackie's Valerie's going to cover instead.
Okay, sorry, yeah, my apologies. So we've got Penny and Valerie covering this then. Great. So who's kicking off? Penny.
I'll give the presentation. Thank you.
Thank you.
Good morning, everybody. For those of you who don't know me, I'm Penny Halliday. I'm the independent chair for the Alcohol and Drug Partnership. I'd like to thank you for inviting me along here today to give you this presentation. And I would like to start by sharing with you some fantastic news that our Specialist Drug and Alcohol Services, our NHS Specialist Drug and Alcohol Services, has just won the Healthcare Award for the best drug and alcohol services in Scotland. That was just announced yesterday. And I'm sure you'll want to congratulate them on this. They've been doing a fantastic job, obviously, that they've won this award. So as you can see from the alcohol and drug strategy, first slide, Jackie Davis is the ADP strategic lead. And unfortunately, as Stephen's said, Jackie can't be here today, so I'd like to put her apologies forward for that. But Valerie's here to work with me today regarding this presentation. Can you move on to the next slide, please? I don't want to read every slide out because I've been in presentations, PowerPoint presentations before, where that can be quite boring and a lot of people just switch off. So I'm going to ask you if at any point you want to stop me and ask me a question regarding a particular slide, please feel free to do so. Or if you would rather wait until the end of the presentation, ask me whatever questions you wish. So the policy drivers for the ADP partnership is the Rights, Respect and Recovery Policy Driver 2018, the Alcohol Framework, the Partnership Delivery Framework and the National Mission, and the Public Health Priorities. The Rights, Respect, Recovery Policy Driver is really the National Alcohol and Drugs Treatment Strategy to improve health by preventing and reducing alcohol and drug use and harm and related deaths. The Alcohol Framework is the national framework setting out national prevention aims on alcohol. And this includes the recent review of minimum unit pricing, the recent consultation of 65p per unit closed on the 22nd of November. The next one is a fairly new policy driver, and that is the Partnership Delivery Framework. And this really is the document which has catapulted ADPs into a much more robust structure. It's been a piece of work, but a very welcome piece of work. So the Partnership Delivery Framework sets out a shared ambition about local government and Scottish Government that local areas have the following in place: a strategy and clear plans to achieve local outcomes to reduce the use of harm from drugs and alcohol, transparent financial arrangements, clear arrangements for quality assurance and quality improvement, and effective governance and oversight of delivery. The framework asks ADPs to assess themselves on 5 standards, and the 5 standards are based on, the first one is, does the ADP have a strategic plan in place, identifying the outcomes that they want to measure? Can the ADP demonstrate that public money is being used to the maximum benefit to deliver measurable outcomes for the local population? Can the ADP demonstrate quality improvement and delivery of outcomes? The ADP must be able to demonstrate appropriate governance and oversight in the delivery of the strategic plan. And finally, the work of the Integration Authority and the ADP should be aligned, and the Integration Authority is able to provide directions to partners in support of the strategic plan. With our ADP, work is ongoing to review and update the local partnership delivery framework, where we identified areas for improvement, and just one or two of them. The important ones is engaging with people with lived and living experience, which I'll come on to later on in the slides, improving governance, quality improvement and risk management. And that's just a few areas that we're working on. The national mission. The aim of the national mission is to save and improve lives through fast and appropriate access to treatment and support, improve frontline drug services, including the third sector, that services are in place and everyone is working together to react immediately and maintain support for as long as needed, that there's increased capacity in and use of residential rehab, and that there's a more joined-up approach across policies to address underlying issues. One major introduction for ADPs has been the MAT standards. And the MAT standards are a key component of the national mission, which supports the consistent delivery of safe, accessible, high-quality drug treatment so that everyone can get the same level of care wherever they live in Scotland. Each alcohol and drug partnership is required to take forward a substantial change programme to implement the 10 MAT standards within services over a 5-year period. Dumfries and Galloway Drug and Alcohol Service has achieved a green status for standards 1 to 5 and are currently working on implementing standards 6 to 10. As part of this change process, it was recognised that switching people from prescribed methadone to a new drug, a relatively new drug called Buvidal, removes the need for daily administration of the likes of methadone and gives people the sense of feeling normal without withdrawal. It can be given weekly or monthly injections by specialist drug and alcohol staff. It's safer than methadone. It reduces pharmacy costs and there's less chance of patients being targeted by dealers and peers. The local service feedback that we're getting indicates that switching to Buvidal has given them people more stability. It's improved family relationships and clarity of thought. It was also said to be life-changing by some. And I can't emphasise that strong enough, that the feedback we're getting from people with lived and living experience regarding Buvidal. So many people are telling us for the first time in years that they have got a clear head and they feel healthy. So Buvidal is a game changer. There is no two ways about that. Mr. McFarlane, you've got your hand up.
Yeah, thanks, Penny. I had a conversation with somebody about this just the other day, and they were saying about the cost of it is significantly greater than methadone. So we really need to see, clearly there are benefits to the individuals, but what's the likelihood of the cost coming down so that we can roll it out further and faster? And are there any indications of the rehabilitation to the point whereby we're getting people back into mainstream work and in society? Thanks.
Okay, that's a really good question. Yes, it is expensive. And we are the highest prescribing ADP in Scotland. We are prescribing more than anywhere else in Scotland. So the people across Dumfries and Galloway have greater access to Buvidal than anywhere else in Scotland. We are about to provide evidence at the February ADP board. I had a meeting with Mark Blunt yesterday, who's head of our prescribing team. We're starting to see evidence that Buvidal is safer. It's keeping people safe. We're starting to see that evidence, which is absolutely invaluable. And I suppose, as far as your question is concerned, are we seeing people going into mainstream community? That's a very difficult question to answer, because people who find themselves in a position where they have problematic drug or alcohol use, that is based on trauma. It can be based on adverse childhood experiences. It can be based on other traumatic experiences that people have faced in their lives, and they're self-medicating to try and cope. So until we address the trauma, we really will not address recovery. And recovery means different things to different people. So recovery for some people will never mean going into a job. They'll never be able to do that. And that's okay, because their trauma and mental health issues will be such that for some folk that's just not going to be achievable. But if they can lead a life that suits them, a positive, healthy life, where they've got a really good quality of life, then that's just as valuable. And hopefully that they are able to one day not need something like Buvidal. I listened to people with lived and living experience a lot since I've taken this job on, not just, in official circles with the ADP, but when I'm out and about. And it means different things to different people, because it's a very person-centred approach. I think you're right regarding it. We'll probably see the price increase regarding this, but away on the horizon, Jackie Endow from Specialist Drug and Alcohol Services told me that there is an implant that has been devised that we can use eventually. It's not ready for use yet, but that would be for people who are well established on Buvidal and want to stop using Buvidal and move into recovery. And we're not there yet because it's not ready for use, but that is something that's on the horizon. So does that answer your question?
Yeah, thanks, Penny. That sort of puts a bit of context around it as well. But also, I appreciate that the administration of this drug means that people don't have to visit the chemist on a daily basis as well, because it's longer lasting. So clearly, if that can help remove any stigma, then that's beneficial. Thanks.
You're absolutely right. And we'll come on to stigma later on, but one of the major implications for people who use drugs and alcohol is the stigma and prejudice that they face on a daily basis, and the shame that they experience, and that stops them accessing treatment services.
Penny,
okay,
sorry, Penny. John Dugan in the room has a question, I think.
Yeah,
okay, John.
Perry, good morning. Thanks very much so far for your presentation. It was two questions. One on Movidal. It absolutely seems to be a game changer, and it's very exciting that seems to be the case. You've given us some examples of the benefits of it, and I think we look forward to hearing more about what the effects of using that rather than methadone is across Dumfries and Galloway and the rest of the country. A question on the residential rehab. I'm really pleased to see that that's going to be a cornerstone and part of this holistic approach, that there's going to be lots of options. And I'm just wondering the availability and if people are wanting to access that option, residential. Is it an abstinence-based programme, or how is it programmed to work?
It's a psychosocial programme, and it depends on the person's individual needs as to what sort of residential rehabilitation facility would be suitable for them. So it could well be an abstinence programme, it could well be not be an abstinence programme. There will be women with children who would want to access the likes of Aberlour residential rehab facilities. What I can tell you right now is that we've spent the budget that we had for this year early on in the year. The residential rehab facilities are a variety of pricing. Some of them can be £20,000 for one person. Others can be 8. When the government set this up, there needed to be a procurement process put in place, and they're in the middle of doing that now. And the other aspect is that, people can go into residential rehab and then realise it's not for them. But whatever the cost of that whole package is, we still have to pay that even although they might leave the facility. So I think, but the bottom line is that we're not being given a big enough budget to be able to accommodate the number of people who are asking and who would be a really good fit with residential rehab. The ADP last year used extra monies and allocated it to residential rehab so that more people could go than the original budget. But we're not in a position to do that this year, and we won't be in a position to do that for the future, because like everywhere else, we're looking at, doing things differently, doing things better. So residential rehab, what I can tell you is that there's a split. I think there's an even split between the number of people who are using residential rehab because of alcohol and others who are using it in relation to drug use. But we would like more money, and we haven't got it.
Supplementary, John?
Yeah, thanks very much. And I think just to follow that up, I think your residential rehab is a key component to all the other strands that we're talking about. And I think we can't undermine the actual importance that has for individuals and the impact on their own mental health, but their family and the wider community. So I would like to add our voices that that is really looked at and made sure that availability is there.
Yes, we're doing everything we can, John. And the people who are waiting for a residential rehab place, we're putting in place as much support in the community as we possibly can to try and keep them safe. The Specialist Drug and Alcohol Services have also come up with an option that they are developing at the moment for community support, which might be a different option for people regarding residential rehab, but we don't know what that's going to look like yet. Any other questions?
Not seeing anybody indicating at the moment, Penny.
Okay. So the public health priorities is a Scotland where we reduce the use of harm from alcohol, tobacco and other drugs. The main focus is on the root cause of harm and the underlying causes such as socio-economic circumstance, and to design health-promoting environments which support healthier choices and reduce harm. Community planning partnerships bring together the main partners in minimising the harm resulting from a relationship with alcohol and drugs. All local authorities have the power and duty to protect and improve public health through the licensing of alcohol sales. We had the highest number of deaths from alcohol last year, and the same across Scotland. So we are seeing an increase in the number of people who are finding themselves with problematic alcohol use, and it's rising rapidly. The government are looking at bringing in MAT standards for alcohol. We don't know when that's going to happen yet, and we don't know what that's going to look like. But I think that would be very welcome, because the focus, quite rightly, because of the number of people dying across Scotland of a drug-related death, has been to try and reduce that. And now we're seeing this rise in alcohol. And there's, you know as well as I do, there's a myriad of reasons for this. But I keep going back to a trauma-informed approach. And if we don't start to adopt a trauma-informed approach across all the services, then we're swimming against the tide continuously. And we need to do that. We need to be committed to that. Equally, we need to be committed to the issues surrounding poverty and what that means regarding people becoming even more folk developing problems with alcohol and drugs. Next slide, please. So the strategy pillars, as you can see, early intervention, recovery-oriented systems of care, getting it right for every child, young people and families in a public health approach to justice. The prevention and targeted early intervention is to reduce inequalities, improve health, involve people with personal experience of drug and alcohol problems, and that is absolutely crucial. To address stigma, intervene early, promote evidence-based education in schools and non-traditional settings in communities, and we feel that youth workers are crucial in taking that forward too. Engage vulnerable children and young people, target risk groups, develop online resources and promote positive choices. Developing the oriented systems of care, or ROSC, to develop a human rights-based approach when planning and delivering alcohol and drug services. Deliver rapid access to recovery services. And we have a number of recovery communities now across Dumfries and Galloway. Reach and maintain engagement with people at higher risk of death. We have one of the best assertive outreach services in Scotland, which I can explain to you later if you wish. I meet with them quarterly. I chair their meetings quarterly. It's a multidisciplinary approach and it's working really well. Target people injecting drugs, deliver effective harm reduction, involve people with personal experience of drug and or alcohol problems. We've just invested in a programme of self-coaching with a company of people with lived experience who set up a social enterprise some years ago. And the self-coaching we're investing in is so that we can encourage and welcome people with lived experience to become official partners on the ADP board and guide us with all the treatment and recovery services that we want to put in place and be active partners. Strengthen trauma-informed approaches, utilise surveillance data and evidence and support the growth of recovery communities. Getting it right for every child, young people and families. And we ensure the families have access to support in their own right. And we do that through our third sector organisations like We Are With You and Alcohol and Drug Support. Alcohol and Drug Support have been their family support services. We Are With You support families of a loved one who has a drug or alcohol problem. And Aberlour as well are excellent service regarding supporting families, as does social work. Ensure all families have access to services, both statutory and third sector, provide through a whole family approach, and provide support in line with the values, principles and core components of GIRFEC. Involve children, parents and family members in the planning, development and delivery of services. And we've got two vice chairs. Valerie is one of my vice chairs, and we have with Stephen Morgan as the other vice chair, and we now have Alison Penman, which is a really good balance for me as the independent chair, because Alison, as you know, heads up children's services. So a public health approach to justice to ensure people in contact with justice system receive seamless support, that they're offered alternative community-based interventions to divert people away from custody into treatment and support for recovery, and to tackle the exploitation, county lines and cuckooing of vulnerable people, disrupt drug dealing and distribution. And as you can imagine, that's one of the most difficult ones. Next slide, please. I don't see anybody's hands up, so...
No, all good here.
Okay. So the local priorities for us, as you can see, make a lot of sense, I hope, to you. Is there any of those local priorities that you want to ask me about? Because we've talked about residential rehab. We've talked a bit about tackling stigma and lived and living experience.
Got Linda
Somebody's got-
Dord. Linda?
Thanks, Chair. Thanks, Penny. Apologies for opting out of the meeting earlier. My iPad and iPhone decided to upgrade themselves and I got a bit lost in IT. Penny, thanks for the presentation. I'm actually on the board of the ADP and that a councillor is on the board. One of the issues you raised was involving people with lived experience more and actually having them on the board, which would be fantastic because they actually know what it's like to go through the challenges. Most of us might not, some of us may, some of us might not. How do you propose to do that? How do you propose that we, sorry, not you, that we do that? How do we get more people interested and give them the confidence and the ability to do it? Because that's a big thing as well, isn't it? Thank you.
Well, the government, as part of this partnership delivery framework, they'll talk about lived experience panels, that ADP should have lived experience panels. And I have to say, based on my past experience, because I've worked in the field of drug and alcohol services for a number of years with families, it wouldn't be a good idea just to, contact some people in the recovery communities and ask them, look, do you want to be on an ADP lived experience panel? So we felt that the best thing to do was to invest in training. And that's why we invested in the self-coaching training, which is ongoing at the moment. I think initially we had nearly 50 folk that signed up for that training. And from that training, what they did in Borders, they managed to identify people from the self-coaching training towards the end of it who wanted to be involved with the ADP. Now, my view is that when that happens, and I think it will happen, that some people from Dumfries and Galloway, towards the end of their training, will identify themselves as wanting to do this. And it's then my job as the independent chair to talk to them and ask them what that looks like to them. And I really believe that I did this on the IGB. Once we have people who are willing to be ADP partners, active partners, then I think we need to be able to get everybody, all the ADP board members, including the lived experience partners, in the same room to do a bit of relationship building and for us to understand, how we all work together. Because as you can imagine, for folk with lived experience, we tend to use a lot of language around forums like this and the ADP, which can be quite disconcerting and can present a lot of boundaries to people who don't, who don't, use the language that is used in forums like this. So the one thing that we have to do is to be really inclusive, and we need to learn from people with lived and living experience. So that, I think, would be the approach that we would take. What their role would be, again, we would work together as an ADP board to flesh out what their role could be and the responsibilities. And they need to have a mandate to be able to speak on behalf of everybody throughout Dumfries and Galloway who has a drug and alcohol problem, and we need to work out how to do that. So it needs to be well thought out, and we're in the process of doing that right now. We take feedback from people with lived experience all the time through the MAT standards. We have an experiential lead who interviews people all the time and collects experiential data. And that is something that we have to do. The government requires that. So, we're well on the road to that. We just feel it's really important that people are treated with the core values that we have and share around the ADP table, and that we give them all the support that we can to encourage them and welcome them to be ADP partners. Does that answer your question?
Thanks, Penny. No, it's absolutely fantastic. I think it's an absolutely essential part of what we do. So I look forward to this coming to fruition. Thank you so much.
Thank you.
I think Valerie wants to come in at this point as well, Penny.
Yeah, thanks very
Valerie?
much. Thanks very much, Penny. As Penny mentioned, I'm one of the vice chairs of the Alcohol and Drug Partnership, and I want really to say a huge thank you to Penny in terms of her leadership of this agenda. She really does bring that and promote the voice of lived experience being around the table. And I think when we've had people come and speak at the ADP board about the stigma that they have experienced right across society, and sometimes unfortunately in health settings as well, it's been really, really eye-opening and enabled us to take that on board and make changes. And I absolutely understand Buvidal is a very expensive drug, but we use lots of expensive drugs in healthcare, and this drug is very life-changing for individuals. And I suppose the point I just really want to emphasise is that when you experience problematic drug and alcohol use, it is a health condition. Nobody would choose this. It's not a path anyone would choose, and I think it's so important that we think about what we can do as a CPP in terms of creating communities that are supportive and enable people to continue on that recovery journey, because it's lifelong and it's hugely difficult for them. So that's me. Thank you.
Thanks very much for that, Valerie. Back to you, Penny.
Thank you very much, Valerie, for that. Those words of kindness and confidence in me. I think it's been a collective effort, though, it definitely has. And we're very lucky that we've got the people that we have sitting around the table. Could I have the next slide, please? Now, I can't quite see it because I'm seeing Mr. Russell on the screen.
Russell, can you switch off your camera just now? Thank you. Hopefully it'll appear then.
That's fine, thank you. So the funding to support the strategy, I would say it's quite straightforward, but it's not. It's never enough money, let's face it. When you see it right at the bottom, we get a budget from the government of £15,000 for lived and living experience. So again, I'm not going to go through this and read this out to you. You can see the residential rehab budget is for 148,000. That doesn't go very far when some of the residential rehabs are charging 20,000 or more. So has anybody got any questions about the funding support?
Not seeing anybody indicating at the moment, Penny. Oh,
okay.
Councillor Dorwood, Linda.
Linda?
Thanks, Chair. Thanks, Kerry. It's just about the residential rehab. You just spoke about that, and I maybe missed a little bit. So apologies if I'm repeating, and just tell me if I am, and we can move on. You said it's maybe 20k for a rehab session for an individual, and the budget's already been spent. And you spoke about some standardisation. I maybe missed that with Scotland Excel. But again, remind me, all the rehab provision is from the private sector, or is that wrong? Or most of it's from the private sector at the moment?
Yes, and I suppose when we say the private sector, we tend to think of is it places like White Craig, but there's also social enterprises that have been set up as residential rehabs. I believe, I might be wrong, but I believe the one in Ayr, I think, is a social enterprise model. And the last Cabinet Secretary was singing the praises of that one all the time. That's a model that she seemed to particularly like. It would be great, if there was a uniform pricing, but because each one will provide, some of them will provide intensive mental health support, and that's why they're more expensive.
So what would the preferred option, as I see, would then be a standardisation of fees so that we could plan better in terms of for next year, say the next financial year, because this amount won't be going up, will it? I don't expect it to go up. Then how many people we could send. So potentially, just to make the Community Partnership Planning Board aware that the vast majority of provision for rehab in Scotland is from the private sector. It's good that it's there. But that means there'll be a myriad of pricing across that, which the ADP has no control over. And obviously, at the moment, Scottish Government has no control over. So that's quite challenging for ADPs to to actually get the best bang for their buck, if that's what you're looking for. I don't mean it as you know, as bluntly as that, but you want to spend your money wisely, but it's quite challenging to do so. Is that a correct assumption? Thanks.
Absolutely. Yeah, absolutely. Because there's no resemblance of uniform pricing and it's in the private sector, you know, it can change at any time. It can go up at any time. We have no control over that at all. And you're right, neither does the government. There's also, as I said earlier, there's also the sheer fact that, you know, we can prepare somebody really well for residential rehab, and that's what the staff do. But that still, you know, that still doesn't mean that when they go into that residential rehab that they decide it's not for them for whatever reason, you know. And as I said, if the package was £20,000 and they're there for a week, we still have to pay that £20,000, you know. So you're not getting your money back because somebody has decided that that particular rehab is not for them. And that's something else that to me is, well, I don't know how many businesses would be able to do that and charge for a service that, you know, I mean, they might say that, well, the place has been set aside, but I would imagine that they're filling those places if, you know, when people have to leave because, you know, it's just not suitable for them. I think this is something that the government has to sort out. My fear is that also, from all the work I did with families years ago, my fear is that sometimes people see residential rehab as being the answer. You know, it's the golden key. If folk can get into residential rehab, you know, they'll be fine. You know, they'll recover and they'll never relapse again. And that's not the case either. Relapse and recovery is part of recovery. And I know that's very difficult for people to hear, especially families, when somebody successfully is in recovery and then they relapse. But unfortunately, that's the nature of the trauma that they've experienced. And sometimes when something happens in their life, it triggers that trauma and they'll relapse. Stephen.
Thanks, Penny. Yeah, so I think the bit that I'm sort of struggling with is really matching the best, if you like, the best value question in terms of what delivers the best value of outcomes for people who are needing the support. You know, so if there are interventions or sort of treatments or packages or just support provided, you know, how would we know from what's been presented today, for example, or in terms of a strategy going forward? Well, we know that if we invest this in this type of treatment, we're getting more positive outcomes for people that last longer or more sustainable, accepting that there's, you know, a lot of this that we have to consider in a trauma-informed way. So you might not be able to address root causes, for example, but like you were saying earlier, that it would still improve the situation for a number of people, for example. But it's not, it might be something you're coming on to, but it would really just be helpful, I suppose, in a very simplistic sense. Well, what outcomes are being achieved and what's generating the best outcomes for the pound spent, if you like, given the risks associated with what we've just heard about, the residential stay being too many factors out with our control, if you see what I mean.
Without a doubt, Vividal. Without a doubt, our main purpose is to reduce the number of people who are dying of a fatal drug overdose. And we're seeing that. I mean, I think our figures at the moment are standing at 4 confirmed drug-related deaths. 4 people have died of a fatal drug overdose so far this year. There are suspected fatal drug overdoses that are waiting for toxicology reports. But when we compare that to where we were last year, I mean, there was 35 people who died from a fatal drug overdose. Now, the majority of, that's what I said earlier on, the evidence which Mark Blunt has been gathering regarding Buvidal and how it's keeping people safe will be coming to ADP board in February. And I'm quite sure we can share that with the Community Planning Partnership. When you say, you know, the outcomes, if somebody had cancer, the treatment would be decided upon based on what would be best for that person. This, as Valerie said, this is, this is about people's health. It's not about a lifestyle choice. So the specialists who work on the coal face will work with people to identify what is the best approach for them. So what is the best approach for them to have the best outcomes on an individual basis? And for some folk, it's residential rehab. But what we're seeing is, as far as opiate use is concerned, and I must be clear about this, Buvidal is a game changer so far. But what I can tell you today is that the meeting that I had yesterday, Scotland is looking at a cocaine and benzodiazepine epidemic. And we don't have any treatment for cocaine and benzodiazepine problematic use. And the government's looking into, you know, what are the possibilities regarding supporting people who are using those substances. The majority of deaths that we've seen with the number of people who've died this year is illegal benzodiazepine, which they're buying off the internet. So we've got no control over that. And we need to try and be able to target our services to do things like reduce stigma, listen to people with lived experience so that we know how to change services and be able to have a welcoming service that people feel comfortable to be able to access services. Nowhere in Scotland's there yet with that, but we're getting there in Dumfries and Galloway. I think, you know, the fact that ESTAS won that healthcare award is testament to that. So does that answer your question, Stephen?
I mean, it's obviously complicated and it's a moving target in the sense that there's emerging issues that maybe aren't addressed by one form of treatment, if you like. And the drug death figure is obviously incredibly important because it relates to life. I suppose we haven't, the evidence isn't here, but it will be. I think that's what you're kind of saying. It'll be at a future meeting. So I'd really welcome seeing that. Just to,
yes.
As I say, it was a very simplistic question in terms of that value for money, like what's delivering the best outcomes. And I certainly don't mean outcomes as a lifestyle choice. I just meant in terms of overall health and well-being outcomes. But yeah, no, that's helpful for now, Penny. Thank you.
Thank you. And so can we move on to the next slide, please? So from our strategy, we devised the delivery plan. It's a 3-year delivery plan, and we've taken the approach that we've asked all the lead groups, the prison, the police, social work, community justice social work, criminal justice social work, ESTAS, to populate our delivery plan to progress each area. It's monitored on a monthly basis and reports to the ADP 3 times a year so that we can identify any challenges. Next slide, please. So the key challenges that we have is, number one, tackling stigma, and that's where the Community Planning Partnership could work really and reinforce and strengthen what the ADP is trying to do by using a people-first language, for example, by challenging people who will use a language like addict, alkie, junkie. It's very embarrassing for some folk to challenge that, but unless we as leaders start to challenge this, it's never going to change. Linda?
Apologies for that. I'm not quite on the ball with my IT this morning, so please continue. Sorry.
Okay. We need leaders like the elected members to become champions, you know, or ambassadors, or you know, have a vital role to, you know, to highlight the truth about people who use drugs and alcohol because they can't cope, that it's not a lifestyle choice and that it's a health problem. We need all the leaders to be able to take that forward and challenge whenever they hear people in authority, people who are working in services, who are there to help people with drug and alcohol problems, use language that's totally unacceptable. So if I give you an example, when I started this job, one of the things that I wanted to do was to have a day where we brought everyone together, and we called it a development day. And we've had two, and they've been really successful. The last one was all based on lived and living experience. And I went round each table to listen to the people talking. And I heard folk with lived experience talking about one story in particular, which stayed with me, who is someone who is a member of the Peer Naloxone Champions. And these people go around our region with their T-shirts on saying "Stop the Deaths," offering training to people to the public regarding being able to administer naloxone, which can, if someone's experienced a fatal drug overdose, they can administer that and save someone's life. And they get all sorts of things shouted at them in the street, but they are not deterred in their mission to do this and have these pop-up events to raise awareness. And one of them had said that now she's been drug-free for 5 years, and she had finished up in the hospital with a chest infection. And she said that the doctor who was coming in to see her about this in her room had come in and said to her, he shut the file and said, "Well, you've been using drugs for years, I don't know what you expect." And she hadn't used drugs for 5 years. We need to stop this. And the only way we can stop it is to challenge it. We need to raise awareness about what's, how damaging that is for someone. And we talk about unconscious bias, when it comes to other minority groups, but we never talk about things like this when it comes to people who use drugs and alcohol. So tackling stigma will stop people accessing services. That's a fact. The evidence shows that. Trauma-informed practice is something that will invite people into services and will help them to stay in services, because one of the things it means is that they don't need to keep telling their story over and over again to different people. They will be working hopefully with one person and have a holistic needs assessment. And that their trauma needs are addressed by really good mental health services. That we have the right amount of staffing, which we don't. I don't think any ADP across Scotland does. And that we have the funding that we need, which we don't. I mean, we've talked about the cost of Buvidal and residential rehab, but these are still not reasons why that we can't work on things like tackling stigma and a trauma-informed practice. Any questions?
Not at the moment, no.
Okay, thank you. Next slide, please. So this is the last slide, and we thought we would finish with a positive story. So as I said earlier, our key achievements are a assertive outreach service, which is saving people's lives. They work with people who have had non-fatal overdoses, and sometimes somebody can have 5 or 6 non-fatal overdoses and then go on to have a fatal overdose. So the assertive outreach service is crucial. MAT standards 1 to 5 we've achieved. We've been recognised by the Scottish Government for the standard of our experiential reporting being an example of best practice for the rest of Scotland. We have the highest recorded number of patients on Buvidal. Our naloxone distribution has increased by, I think, 180% this year. There's been an ADP app developed for people to use regarding their drug and alcohol use, where to access help, information for families regarding click and collect services for naloxone, stuff like that. Again, that's been held up as a really good example of best practice, and other ADPs are asking our development worker, Jacqueline Stewart, if we can share this with them. We've got a development of a new performance management framework, which has been set up by George Noakes and NHS Strategic Planning, which will be, again, transformational for us. With that, goes back to Stephen's question about outcomes. So this will be up and running pretty soon, Stephen, and we'll be able to share all these outcomes with you guys at community planning. We're seeing a growth in the recovery communities across the region, which is being supported by the Recovery Communities Worker. We've developed a women's group specifically because we uncovered the needs of women. And we uncovered the fact that very few women are requesting residential rehab, and we're looking into the reasons why that is. We have offered recovery and self-coaching, and we've had a huge uptake, and our development days are very successful. We're having another one in April. So that's the end of my presentation. Happy to take any further questions that you may have.
Thank you very much for that, Penny. It was very comprehensive and really, really interesting. And I'd just like to echo Valerie's comments and commend you on your leadership and a tremendous team that's clearly doing some brilliant work. And on behalf of the board, I think you would like to acknowledge that. Members, I'm in your hands. If anybody has any further questions, Stephen's been frantically jotting things down. We've maybe not spelt things terribly correctly. But I think from that, what we need to understand as a board is how we can assist you further in some of the work that you're doing. I think the residential rehab area is maybe something that collectively we need to look at. And certainly if you need a lobbying position around standardisation of fees, or we need to look into what we can do in that space. I think certainly through my leadership and Stephen and Linda and Andy and John and co, we can look at how we can become ambassadors for you and for people that need that assistance or champions. We can look at that sort of within the council and how we promote that through our elected member streams. We'd be very happy to do that. I don't know if there was anything else that you'd reflected on, Stephen.
Things, if you'd like. Okay, thank you, Chair. Just some additional notes to capture in the minute for consideration. I would suggest recognising and congratulating the service on the National Health Care Award achievement. Certainly the importance of the 5 main policy drivers that Penny highlighted. That this is the review of the partnership delivery framework and the work ongoing in terms of engaging people with lived experience, the reviewing quality improvement, risk management and governance, the significant importance and early impact of the use of Buvidal and the emergent evidence to support this, the impact of trauma and adverse childhood experiences, and the importance of embedding trauma-informed approaches across services, the impact of the residential rehab that you mentioned, Gail. Yep. The important role that community planning partnerships can and should be playing in relation to delivering on public health priorities. The concern over increases in alcohol-related deaths, and welcome the review or new MAT standards to help address this. Recognise the work ongoing in terms of integrating people with lived experience onto the board and the success of the self-coaching approach. And the key challenges at the end there, particularly tackling stigma and the role that the CPP and partners could play in challenging behaviours.
I think that's a fair summary. Anybody got anything else they'd like to add? Okay, so we'll capture that in a minute and then we can work that through our normal systems, if that's okay. Good. Thank you very much for your time this morning, Penny. That really has been incredibly insightful.
Thank you so much. Thank you so much for your offer of support. And if I can just add that our next development day, which is a big day, is on the 16th of April in Dumfries. I think it's in the Baptist Church Conference Centre. And the people that you mentioned who may be able to become take an ambassador role would be more than welcome. We would like to invite them on the day, and we would like to maybe invite you to have some people with lived experience join one of your meetings at some point to be able to talk to you. So thank you so much, and thank you so much for your comments today.
That's great. Oh, John?
Yeah, absolutely. So when that development day is planned, it might be worth having that date circulated for members of the community planning, and it might be that we can actually be there and be learning on that day too.
Absolutely. Yeah, no, we'll ensure that's done. Good, another action. Super, thank you.
Thank you, thank you, thank you.
So we're moving on to item 4. Ingrid and Liz are both online, so that's great. And they're here to speak to the Loip Locality Plan End of Year Report 22-23. Who's first?
I'm happy to go first, I think,
Liz,
since I'm Appendix 1. Thank you. So yes, as the covering report indicates, this is the 6th annual report that you've had on the first Loip, and also the 6th locality plan report that you've had, which in this first iteration was very much focused on a thematic issue. So it's a fairly standard approach. You'll see that we've given you the trend information over the years so that you can look at how things have developed, and as well as there being local performance information, there's also national local outcomes profile for you to have a look at. So very happy. I think I'll leave it there. Hopefully you've had a chance to read through it, and happy to answer any questions that you might have. Thank you.
Many thanks, Liz. So I'll open the floor to members. Any question or comment? Valerie?
Thanks very much, Liz, and it's a really comprehensive report. We're obviously kind of in a bit of a changeover period between sort of old Loip and the new Loip, and there is so much good work that's going on that's really evidenced in the report, and it's really, really lovely to see that. But I guess I'm thoughtful a bit about maybe the assessment of the outcomes, because from the evidence that we are seeing in terms of health inequalities, our life expectancy, as is in Scotland, is decreasing. Our healthy life expectancy is decreasing. We know that people who live in more deprived circumstances, their health outcomes are poorer. And I guess the kind of benchmarking for the national, against the national data kind of highlights some of that. So I think, as a community planning partnership, we should be looking at that long term and really have our eye on those long term outcomes going forward. But there's also something about measuring the progress, which is very evident in this in terms of taking it forward. But I just think I have to highlight that in terms of health and well-being and inequalities, I think we've got a lot of work that we need to do in that area, but a lot of really great examples of work in this report. So thank you.
Thanks, Valerie. Any other members? I'm not seeing anyone indicating at this stage, Ingrid or Liz. So with that, we've considered and agreed the 6th Dumfries and Galloway Locality Outcomes Improvement Plan Annual Report for April 2022 to the 31st of March 2023. And we've considered and agreed the 6th Dumfries and Galloway Locality Plan Annual Report from 1st April 2022 to the 31st of March 2023. And there's no amendments at this stage. Okay.
Okay.
Thank you.
Thank you very much indeed.
Thank you.
Thank you.
Thank you.
So moving on to item 5, which is the LOIP update, including LOIP action plans. I think, Stephen, you're going to lead on this, and Valerie's obviously here to support as well.
Thank you, Chair. So the focus, certainly, of the community planning senior leadership team over the last couple of months has been developing the LOIP action plan, which has considered the feedback from previous workshops and discussions with leads of partnerships and plans, and trying to identify that added value element. That was the original purpose. And what we've landed on in Appendix 2 is 6 key areas where we feel we can add that value, where there's opportunities to grow and work together, and certainly around community wealth building and the role of anchor organisations, our commitment to community transport and the future model, digital exclusion, and we were also committed to addressing the top issue in the 10,000 Voices consultation, which is around smoking and vaping, and one of Valerie's teams developed a potential intervention that will be worked through. We've also got to embed our locality plan approach, and finally, the feeling of the leadership team was we really need to get into the nuts and bolts of some of the delivery plans in terms of the 12 plans and strategies that contribute to our model, just to ensure there's no duplication, but to pull out the key areas that are really strongly linked to our new outcomes and how we can use that going forward. So that was the 6 key areas, and we can come back to that. Probably at this point as well, there was the late paper on the response to the UK consultation on vaping, which Valerie's team again has kindly produced a suggested submission, which it would be great if the board were able to endorse that. In Appendix 3, we've got some initial stats from the census, and certainly some concern in terms of the 65 plus and age group, and it's second highest in Scotland, implications for our future working age population as well. In Appendix 4, and hopefully Tom Fowler from Public Health Scotland might be with us, we have 2 summary overviews. This links to the data profiles that have been produced recently, and a request to try and simplify and have a one-page overview. And there's 2 samples of a same profile that we can just put or give some consideration to in terms of preference. And if Tom's here, he might want to speak to that in a little more detail. And finally, in Appendix 5, it's a comms plan to help launch the LOIP and those profiles as well. So we can maybe take those, maybe one each in turn, and work through.
Yeah.
Okay.
Tom, do you want to add anything at this stage? I think he is online. Hmm?
Yes.
He'll come in when he wants. Members? Nobody indicating at this stage, Stephen. I mean, obviously, you know, this is the new plan and it's just sort of in its infancy as such. So, yeah, there'll be very much a work in progress going forward. But I think crucially around the consultation, has that been shared with all?
Thanks, Chair. Yeah, it was circulated separately to the paper, so electronically, and there's a hard copy here today. So again, if members want to raise any thoughts or comments on it, or other than that, if we're happy to endorse it and we can get that in the minute. Thank you.
Yeah. John?
Yeah, absolutely. Very happy to endorse that submission to the UK government. I think the issue on vaping and smoking on the 10,000 Voices, obviously talking to colleagues in YouthWorks, you know, some people will be smoking and vaping because of other issues going on. So, you know, while it's a key concern, we obviously, as a community planning board, need to address all the other issues to help solve them all together at the same time.
Valerie, were you wanting to come in at that point?
Yeah, I think you're absolutely right. Sometimes that's a symptom rather than just, you know, the actual sort of kind of it's a response to symptoms of wider things. And I think that's one of the key things in terms of looking wider at our partnership plans that we've got, because there's a huge number of actions right across those plans, and there's a huge and and actually what are the priorities that we really need to focus within the plans, and really ask our partners, our partnerships to work on and focus, because we can't do everything all at once. So I think that is important focus. And I think probably the thing that I would just want to highlight, vaping really is an issue, but tobacco use is also really important to tackle. We mustn't switch off the focus just from tobacco to it's got to be tobacco and vaping together. And I suppose just really in terms of that action plan, I also sit in the community planning senior leadership team. So we are a relatively new team, coming together. And I think probably some of the actions in the plan that we've got are a new way of how we'll work together, because these are the things that we want to really focus on and deliver on, and I guess it'll be an iterative plans that are going forward. But any feedback that any members have is really welcome. Thank you.
Any other members? Russell, morning.
Yes, just to say, Gail, that with you and I's other hat on of regulation, we discussed this yesterday. And so Scottish Government and the Regulatory Review Group, which I chair, as you know, are already on the case on this one, looking at where we go next on this. The challenge is that the piece of framing legislation is vast, well, it could be vast, that brings all this in. So it's about how we deal with the individual bits of it, Gail. But happy to feed in as time goes on as we get down that road, Gail.
That's really helpful, Russell, yeah, and I think we need to have a very clear position as a board, but as you say, there is a lot going on in other spaces, and certainly we've already written to both Scottish Government and UK Government as a council to look at banning of disposable vapes. So there's lots of strands, and I think that combined lobbying will be very useful. But John, you want to come back in?
No, absolutely, that's very welcome. I'm just wondering if you've had any response from either of the governments and their comments and observations.
I'm fairly certain I have. And I can't remember whether it was one or both, but I'll double check back through my inbox. And yeah, they're not confidential, that they've been shared with elected members as well. So yeah, I will hunt those out for you. Oh, yeah, Stephen, do you want?
Thanks, Stuart. Maybe just to give Tom, might be having some connection difficulties, but maybe just a chance to come in and just talk about the two sampler profiles. Oh, there he is.
Thanks, Stephen. Okay, I'll just share my screen and through the PHS and Dumfries and Galloway localised working programme, as Stephen alluded to earlier, we've been developing some area profiles, reasonably detailed and lengthy documents. With an output from this is how do we make something that's accessible and easy to read and easy to infer. And at the moment, we've got two outputs for consideration. With the first one on screen now, which was looking at within the Middle and Upper Nisdale locality, where we have some indicators of interest, where we've got potential significance compared to the Dumfries and Galloway rates across a range of different domains, trying to interpret where we may have some aspects for consideration that are either known within the community or affirming what's in the community. But also how do we start to identify some aspects for those local action plans as well. So this is used as something as an accessible version where if there's a desire to look into more detail, then we'll access that, give access into a portal for the more detailed reports. So for this first one, this was primarily started as a way for engagement. This triggered some quite interesting and useful discussions within our localised working programme. So colleagues across Public Health Council and local performance and intelligence teams. With some subsequent feedback, I'll just move on to the second version. So this gives a bit more detail, including some dot plots within the items to give that interpretation of how much higher or how much lower is one of the areas within the community. So within this example, we can start to see for the life expectancy within Upper Nisdale is quite a bit different compared to Mid Nisdale and Thornhill and Dumfries and Galloway for males. Within females, that gap's a bit tighter for Upper Nisdale. However, there's some positive stories in the sense that the Thornhill life expectancy is quite a bit higher than the comparator regions. So there's a couple of different approaches we've been taking just to try to interpret how is this going to drive the best engagement locally with different partners. So absolutely welcome consideration and any feedback within this, which all feeds into that wider local action plan and locality profile resource packs. Thank you.
Thank you very much, Tom. Okay, Valerie.
Yeah, just to come in, just say I'm really grateful to colleagues in Public Health Scotland and colleagues within my team as well for helping to build together some of this, because I think it helps to really look at our areas where we have the most inequalities, accepting of course that as a rural region we do have pockets as well. But I think in terms of the second profile, which it doesn't come up very well on the screen, Tom, but it is in our packs, which shows the differences that there are between the different areas, is really helpful. And I guess the next step is actually testing this with communities, because if we're going to, as we've talked about, pilot a different approach to ways of working through our locality plans, it would be, what do communities make of this? Is this helpful? Do they know this data? So there's almost like a testing phase of it to see can communities make sense of this? Do they find it helpful? What does it add for them as well in terms of that community engagement for how communities want to take things forward and see improvements in these stats? So thank you.
Thanks very much, Valerie. Any other members? So, on that basis, I mean, we'll endorse this consultation response, absolutely. I think there's no question of that. And look at other means, and I know that, Valerie, you're working on, is it a mailing for Scottish Government as well, or... Because I'm very aware that we get into this Internal Market Act thing as well, and it sort of straddles both governments. And certainly I have now remembered when I sent the letter to the Department of Health and Social Care, they passed the buck to DEFRA. So it's sort of spinning around a wee bit at the moment. So really, what's your sort of plan through the board to do?
So I guess what we're working on with colleagues in Public Health Scotland is a bit of an evidence briefing. So what do we know? What don't we know? What are the actions that need to be taken at local and national level just now? And what is is an emerging issue now? Events are in some ways ahead of us in terms of this consultation is already happening. So there is a look at that legislation as well. So I think responding to this consultation is absolutely key, because that's hopefully a really positive step to really tighten up the market in terms of both tobacco not being available to our younger generation, but also to tackle the marketing of vaping products, which is happening to children, which is I find very difficult to see what's happening in terms of that approach that's been taken by this industry. So once we've got that evidence briefing, that is then a platform to look at, well, actually, what do we want to do locally together? Anything further? I think we're doing well. I think we're taking action. We're being proactive about this, particularly in response to the 10,000 Voices consultation. But is there more that we need to be doing just now? Thanks, Gail.
And just on that, what sort of timeline would it come back to us potentially, or is it too early to say?
I am pushing it for as soon as it can be ready, but it'll probably be early in the new year, Gail, would be my estimation. Thanks.
Okay, brilliant. Linda?
Thanks, Chair. Thanks for the report. It's really interesting. I'm just drawing attention to Appendix 3, page 87, which doesn't tell us anything we don't know, but tells us a bit more detail, more granular detail in terms of the Scottish Census population, which is actually quite something I think we should be focusing on. I know it's in the plan, but we have the second highest population of over 65s. That's and I know it's something we speak about constantly at council, and also in terms of health. I mean, I mentioned this the last time. Our population our older population is increasing, our younger population is decreasing. And it's about, as a community planning partnership, how do we focus on reversing that? Not making having less old people, but having more young people, because our public services going forward may not have enough people in them to actually manage the challenges that we have as a region. So I think it's something that we talk about quite a lot, and it's almost something that we don't accept it as a given, but I think we need to look at that with a greater degree of urgency than perhaps we have been doing. Thanks, Chair.
Thanks, Linda. I absolutely agree. And I think the last stat that I saw was 29% of people in the region are economically inactive, the majority of which are through choice. So, we're not attracting, and that was discussed at Education Committee yesterday, that we're not seeing new families coming into the region. It's predominantly, people choosing to come here to retire. So how we manage that population discussion is really, really important. John, did you have a question?
Absolutely, and I think it was just to follow up from Valerie. I think we need to absolutely get the evidence written regarding the smoking, vaping, tobacco. But I also wonder whether the intelligence that from colleagues within the council and licensing, because clearly it's a licensing issue too, and what sort of impact it's having on that team across the region about having to go and do calls on localities across the region. I know from talking to some young people that the accessibility is huge, and calls are into licensing teams, and so I think that would also help maybe cement that help us moving this forward.
Yeah, I think that's a really good point. I can't remember where I was recently, but it was a cafe, and they were selling disposable vape products, and so it doesn't seem to be terribly tightly controlled at where you can sell them. Valerie, do you want to come back in?
Yeah, I think that the regulation is absolutely critical, and I know this is a public meeting, so I would actually call on retailers to really think about how they place these products and how products are promoted, because there are products which have sweetie flavours, there are products which are clearly targeted at children, and children are not able to buy these products, but you make them attractive, you make them, and children and young people want to buy them. So I think there's something as retailers that people could think about in terms of their ethical position in relation to some of this. But regulation is key. My understanding is that the council licensing colleagues don't have any powers in terms of this area, but trading standards colleagues obviously do, and they have been working in this area and doing test purchasing and looking at getting sort of illegal stocks off shelves of things as well. So they have been active in that, and they will be continuing to work with Youth Work and our Smoking Quit Your Way service in terms of the programme of work that's outlined in the LOIP as well. So there's lots of whole system work that we need to do to tackle this issue. Thanks.
Yeah, thanks very much for that, Valerie. And I think I've actually said in this forum before, one of the village shops near me, all their windows is just a multicoloured, enticement of watermelon and strawberry, and it's in your face the minute you walk, not even through the door, and the first thing you see once you're in is great big display cabinets. So yeah, it makes it incredibly enticing. Valerie?
So I just want to make one important point is that we do know that for adults who smoke, that if they move to vaping, it is less harmful. So that is important, that that can be a tool for adults to stop smoking. I think my real area of concern is in relation to the targeting and marketing to children and young people, and we know there are some effects of that just now. If you've got nicotine in things, nicotine is an addictive substance, and it can potentially cause have impacts on kind of brain development as well. So so there's we don't yet know the full impacts of this, but certainly having having an addiction at a young age to a substance like nicotine is not what we would want for children, young people in this region. But for adults who are smoking, vaping does appear to be a safer option for them with a regulated product. Thanks.
But presumably, and within your sort of work, the majority of adults that are trying to make that transfer from smoking to vaping will be using non-disposable vape, the permanent ones, the bigger ones. I don't know what you call them, non-disposable.
Gail, I couldn't actually answer that just now, but I could take that back to the Smoking Matters team and see and get that response. Thanks.
Russell.
Yeah, well, just to bring in part of the conversation we had yesterday, Gail, that with Dave Anderson, who said, I think, is the chair of the Trading Standards Officers in Scotland. He chairs the group. We're saying this is a really, really challenging area. Nobody wants these to be sold to young people, and we should be doing everything we have. The challenge is, and it's probably the same for you, one guy who's got them all in the windows, is for small rural retailers, these are a huge source of profit. They make an awful lot of money out of them on an individual basis. So I think, but a lot of them, if you really ask them, probably don't want to do them. But there's this balance, and Dave was saying that's a different difficulty that the trading standards officers have, is they know the downside of this, but they also know that at the moment that's what keeps some small rural retailers alive, just because of the individual profitability on them. So it's a really tough decision. And when we were talking yesterday, Dave listed about 12 things that trading standards officers are going to have to get involved in, including disposal of the throwaway ones. So this is going to add a challenging burden, I think, to the trading standards people around this, because there probably aren't two sides to this story, but there are two ways of looking at it, if I can put it to you that way, Gail. Yeah, absolutely. Yeah, and the other risk that's been highlighted that isn't as much health related, but potentially could be, is the fire risk of the lithium-ion batteries as well, and that's certainly making it more expensive for us to ensure the MBT plant, and has a risk within households that when they do ignite, they're not easy to put out. You can't put them out with standard fire prevention products. So yeah, there's sort of wider implications. Okay, so nobody else looking to come in at this point. So we've been asked to consider and approve the draft LOIP action plan as outlined in paras 3.1 to 3.5 and as detailed in Appendix 2, subject to partners agreeing their respective commitments to their own decision-making processes. We've considered and agreed to the proposed response to the UK Government consultation on vaping and acknowledged that Valerie and co are doing a power of work in this area as well. Consider some of the key initial messages from the census as detailed in Appendix 3. Consider the summary profiles from Mid and Upper Nithsdale as detailed in Appendix 4. And thank you, Tom. And approve the comms plan as attached in Appendix 5. Are we all content to do that? As I say, first steps. Yeah, early days, lots of work still to do, but that's great. Thank you. So moving on to item 6, which is strategic funding streams, which could obviously contribute to the LOIP. And Stephen, you're going to speak to this report.
Thanks, Chair. This has been a request going back several months, so it's taken a bit of time to get all the information together and also working with Norma's colleagues as well. So at 3.1, there's 4 main ones there in terms of the Coastal Benefit Fund down to the Regional Community Benefit Fund, and there's more detailed work in the appendix which actually details individual awards, and officers across community planning partners have done some initial mapping in terms of how that might contribute to our LOIP outcomes. And then at 3.2, we have some more recent funds which are just either open at the moment or just coming to an end. And it's suggested that there could be a phase 3 in terms of 3.5 if we wanted to continue the process in terms of widening the net and capitalising on those new funds that are going to be coming on board. So we've got the full picture. So it's really just for awareness raising, but also it could be some comments that members want to make. Thank you.
Yeah, thank you for your work on that. As you say, it's been quite a lot to pull together from various streams and but it does show the value of that funding across the region from various streams. Norma, do you want to contribute to this as well, please?
Thank you, Gail. No, just to confirm, yes, it is a huge task and actually not quite complete. And I think the only point I'd want to make to the Community Planning Partnership Board is just how bewildering the range of funding options are to the third sector, which is largely dependent on them. And we could probably do more work on this to try and make it more accessible and more understandable. But it's a really good start, and I'm grateful to Stephen for his help with it. Thank you.
No, and thank you. And I know that the communities for sure are also very grateful for the work that your team does in trying to sort of navigate that landscape with them, because it is incredibly complex. And if, you know, community groups don't have a dedicated individual that's just constantly filling forms in and knowing where to go, they often do miss out. And my worry with these tables is that it's often that very small group that doesn't have the capacity, that needs the assistance the most, whereas somebody who's a bit more established, or a group that's a bit more established and have a dedicated individual, get continual funding that they don't always maybe have the same value in. So yeah, it's a difficult one. Right, I've got a hand up, but I can't actually see who it is. Councillor Campbell. Is it? Is it not sure? It's John, yeah. John.
Thanks very much, Gail. Good morning, or good afternoon. No, good morning still, thank goodness. Yeah, on the UK UK Shared Prosperity Fund on page 100, I'm just looking for a wee bit of clarification here. It mentions about the Borderlands Place programmes. Now, just a bit of clarity around, I thought Borderlands funding was completely separate from the Shared Prosperity Fund. I'm just wondering if we can get some clarification on that, Gail. Thanks.
Stephen, can you clarify that? I should probably know better than most, but I'm just reading the pages.
Yep, so the information was provided by our employability team, so I would maybe need to check in more detail on this. Russell might know in terms of the Borderlands Place plans, but if not, we'll mark it in the minute to go back on. So,
yeah, thanks very much, because we just agreed, funding from Borderlands to support the Stranraer and other place plans across the region, and it was just looking at that particular funding. Are they separate, for example, or is it the UK Shared Prosperity Fund that's funding that? Just a bit of clarity, that's all. Thanks very much.
Yeah, no, I totally get that. I'll bring Russell in, and we'll take it away as well. Russell?
Yeah, just to say, taking Stephen's point, we discussed it at the Borderlands meeting 2 weeks ago, and the Stranraer one was given special praise, but I've seen a number of the others are coming through, not yet done, if I can put it that way. But I think we see place planning not just in the Borderlands context, but more generally across all of what you guys are doing, is absolutely critical to what it is we're going to be doing over the next few years, because it will help us look at housing and all sorts of stuff that we want to do. But so there are still some to come through from Borderlands, but the Stranraer one was given a special praise, if I can put it that way, of where it was. The challenge you have about Borderlands is the Treasury's already said, if I remember correctly, that you can't match it with other HMT funds like Levelling Up. So it's got to be separate. But that's my understanding, that you can't match it, and that's part of the challenges we have.
Thanks, Russell. Yeah, and I think that the Borderlands Place programme is very specific to specific areas like Stranraer and Kellerholm, and Norma's saying 5, Kellerholm and Kirkconnell, and I'm not going to list them all. Whereas our place planning programme through the council is out with that as well. So yeah, there's lots of tiers. Norma?
I think the reason why one small part of the Borderlands programme has been included in this report is because it's all part of levelling up. But it is the part, as Russell says, it's the most of Borderlands is capital. And this little bit of Borderlands is revenue that is available, if you like, for place planning. Yeah.
Are you quite happy with that, John?
Yeah, I'm quite happy with that, Gail. No, it's just when you first read it in the report, it was a little bit confusing, but thanks very much.
I know. It's a very confusing landscape, as I said, but Stephen and I will take that away and just get absolute clarity from the economic development team around that. Good, Valerie?
Thanks, Gail. It was a really, really helpful report. I certainly think from like a health perspective, seeing, you know, the number of funding streams that are available was really, really helpful. And I guess my question around about, because obviously these are administrated by different partners in community planning, do we come together and talk about the funding and how these are used together? Do we have a forum for that? I know there's probably forums for each of them, but how do we strategically come together and look at some of this, even though they're administered by separate parts of community planning? I just wonder how that's done, and apologies, it might already be in place, but I just made me thoughtful. Thanks.
No, absolutely, and I totally agree with you. Before I bring Norma in as well, it's trying to ensure we're not getting duplication. And you know, and it's sort of getting the absolute value from these funds that we need to, and that happens across pretty much every area that I work in. You know, is there duplication, and can the money be used to its absolute best? Norma?
Well, Valerie's gone straight to the heart of the thing. If I think back to the origins of this exercise, which was a conversation that Richard Grieveson and I had, it was. And I think it took place also at CPEG, where we said, is anybody taking an overview of how all of this money in all of its different pots is being spent? And I think everyone accepted it was a legitimate question to be asked. And the first step was to try and get a handle on what is coming in. These are all external funds that are coming into the region from the UK and Scottish governments largely. And so I would absolutely see this as the first step in a longer exercise where we start to look more carefully at coordination, avoiding duplication and all the rest of it.
Stephen, where would that work sort of take place? It wouldn't particularly be within the board, would it? Maybe on a more sort of strategic...
No, thanks, Chair. So, you know, there's a lot that sits with the economic development team as well, and you know, we initially put this paper to the community planning senior leadership team. So, behind the scenes, I can liaise with the key officers to try and pull that together and get that strategic picture and get the dedicated names of senior officers who oversee these and try and pull it together that way. I would suggest.
Excellent. Any other members? Nope, so we've been asked to note the main external funding streams available from the scoping work that's been undertaken to date, the awards made and how they potentially align with our new LOIP outcomes as detailed at 3.1, and note and consider the further opportunities currently available at 3.2, and consider extending the scoping to cover the areas outlined at 3.5. And you've taken some notes of some points that have been made and some other work that can be done out with, if that's okay. We all agreed? Good. Okay, item 7. So this is an update on key plans and strategies. It's a standing update on the plans and strategies that contribute to the LOIP. For this quarter, leads were asked to map key work against the new LOIP outcomes and highlight any specific activities in relation to winter resilience. And this is reflected within their respective reports for interest. So key points are highlighted in the overview paper, but as usual, we'll go through each plan in order to allow board members the opportunity to comment or ask questions. Stephen, I've got a slight error. You were going to clarify there was an error on page 107 in relation to
That's
alcohol
right,
and
Chair.
drug stats.
Yeah, thank you. No,
Okay.
it's just to highlight, to avoid confusion, just under 3.3, I've referenced the figures as compared with 2022, but it should be 2021 for both
Okay.
alcohol and drugs. That was all. Thank you.
Okay, that's fine. So we'll go to the Alcohol and Drugs Partnership Strategy and Delivery Plan. Do members have any comments or queries? Not seeing anybody indicating. Obviously, I think Jackie will take notes of any comments that are made as well, won't she?
Yeah, can I just mention?
Yeah.
Thanks, Chair. Just on this one, so as part of the new model for community planning, the Alcohol and Drugs Partnership has been brought in as a new and very valued addition. So this is the first time that we've received some performance management information alongside the others. But in general, this is something we want to refine and try to get more data focused as we move forward as part of the new model.
Thank you. Yeah, and I think it was very helpful having Penny earlier on, because although we've seen an increase in drugs-related deaths during 2022 compared to 2021, we're seeing a marked decrease in the work that you're doing within health and the ADP as well, which is very much welcome. So yeah, that was good to hear. Anybody wish to come in on this? What's in the chat? No. Okay. So we'll move on to the Children's Services Plan. And any comments will be fed back to Jim. Valerie?
Yeah, I just think it's really great to see that they've looked at streamlining things for. I noticed they had said they had over 20 multi-agency groups that were working on this plan, and there's got to be duplication in terms of that, and it's really, our resources are so precious. Our staff, have so little time to be attending meetings because so actually really focusing on those key priorities, getting the work done and delivered is just so important. So I suppose it's just to acknowledge that work that's being done to really focus down on that and that plan. Thanks.
Yeah, absolutely, Valerie. Okay, moving on to Dumfries and Galloway Community Justice Outcome Improvement Plan. Any comments or queries? No. And then CLD Partner Strategic Plan 2021 to 2024. Valerie?
Yeah, there's so much in these plans. Gail, I could ask lots of questions, but I suppose one of the things which is in the Community Learning and Development Plan, there's so much that goes on, such important work. But I suppose one of the things I want to recognise was the climate training that's ongoing as well, in terms of for our communities as well, because that is just so important in terms of kind of future health and well-being and to achieve our kind of net zero ambitions. So just really to acknowledge that. Thanks, Gail.
Thanks, Valerie. Stephen? Yeah.
Thanks, Chair. It was just to highlight, mentioned in the paper about the imminent CLD progress visits. We have a network with the 3 Ayrshires, which has been established for over 5 years now, so that's been really good. All 3 Ayrshires have received their visits, so we regularly share information and learning, so that's helped. We've got a little bit of an advantage in that those 3 have went first, so that's going to help prepare. Again, it could be January, could be April, but work's ongoing to make sure that we're as best prepared as we can. Thank you.
Great, thanks, Stephen. And I think we should note that preparations are underway to prepare a new plan by September next year. Yeah, so that work's ongoing as well. Okay, on to Employability and Skills Partnership Delivery Plan 2022 to 2027. And again, there's been a positive performance figures for Q2, so that's good. Any comments from members? No. And on to Local Development Plan 2. So there's been 29 expressions of interest from community groups in relation to place plans thus far. and 13 are actively working on preparing a place plan for their area. So that's really positive as well. And certainly it's been recognised at Borderlands that the Stranraer Place plan is a bit of an exemplar, and the Kirkconnell Kellerholm one as well. So, you know, we're trailblazing in that respect, and I think Scottish Borders are looking to us to replicate some of that, which is good. So, Valerie?
Sorry, thanks, Gail. Just a question, couple of questions. On page 127, it says that for the evidence report, there's been some challenges about getting evidence around healthcare infrastructure, and I suppose I was just wondering, is there anything specific that we need to help with to get that evidence that's needed? So I guess that offer is there from us in terms of what's needed, and we can see if we can get it to you, to lead officer. And the other one was about the evidence gathering for LDP3, and it feels that that's like a really important sort of background report for how we go forward for development for the region. And I just wonder, does that come back to the community planning board to have a look at from a kind of partnership perspective? So that's me, thanks.
Stephen, do you want to pick up those two?
Thanks, Valerie. Yeah, there's a project board set up for LDP at the moment, so I'll have a chat with Shona McCoy just on that detail about the infrastructure, and then I can clarify with you what it is that's outstanding. And yeah, I fully expect that once all that evidence is collated, that it'll come back at the relevant point, but I can confirm that with Shona. Thank you.
On NHS, on the health?
Yeah, on the infrastructure,
yeah.
yes. No,
yeah.
That's fine, yeah.
That's good. Okay, moving on to local housing strategy. And the development of the next housing strategy is currently underway. And Jamie Little will be leading on that, I presume? Yeah, good. No comment. Oh, there is a hand. John?
Yeah, thanks, Gail. It was actually on the previous report. It's good to see that communities, are taking an active involvement in place plans. But I suppose my only concern would be, council resources with the number of place plans that are being brought forward. That's all I wanted to pick up on. Thanks.
Thanks, John. Yep, we'll note that as well. Absolutely.
Thank you.
Okay, so moving on to poverty and inequality strategy, and there's been positive work to develop the Winter Warmth programme, which obviously helps ease impacts on most vulnerable in relation to energy bills. Anybody else have any comment? Linda?
Thanks, Chair. It's on the local housing strategy. Whilst that's really positive what we're doing, I think we have to acknowledge as well as a board that we do have a housing crisis in Dumfries and Galloway. We have a housing crisis across the whole of Scotland, and it is as challenging in Dumfries and Galloway. There are a lot of positive things happening, a lot of positive finances and funding. However, we need to acknowledge that and again look to how can we as a collective group influence that positively. Thanks, Chair.
Thanks, Linda. Yeah, it's a very good point, and it's certainly a matter that's raised in lots of forums. Regional economic partnership within the council plan here. So, Stephen.
Yeah, just a suggestion. We've got the forward plan item coming up, and it might be worthwhile, given housing's one of our key outcomes, maybe getting Jamie along and just presenting what the current position is and the challenges, just so everyone is fully aware and what we could potentially do as a board.
No, that would be good. Very helpful. Russell?
No, just to say next week, is it next week we have the rep? Gail, I can't remember. I think it's next week.
8th.
We will present where we are with the Housing Grand Challenge, which we now start to see a little light at the end of the tunnel, but a long way to go, and there's maybe some areas of focus that we can do. So happy once we've done that. If CPP wanted to hear that, to bring it back here, Stephen. So, but hopefully next week, once we discuss it at the rep, we'll have an initial, and it is only an initial way forward across probably 6 themes that we think will help us to get to where we need to do. But it's complicated, if I can put it that way, as you can imagine.
Very much so, yes. Thanks for that, Russell. Okay, so I think we've got to the poverty and inequality strategy. All happy with that. South of Scotland Regional Economic Strategy. And we've noted that an updated version of the RES delivery plan will be presented for approval, as Russell said, next Friday. I think, yeah, Friday the 8th. No comments. Okay, so we've note the progress being made in relation to the key strategies and plans that support the LOIP as detailed in Appendix 1. And we've given some constructive comments and feedback on a few areas. So that's great. So moving on to item 8, business brief. Stephen?
Okay, thanks, Chair. Yep, some important issues that have progressed over the last couple of months or so. So there's a bit more detail, as I mentioned at the start of the meeting, on community transport. And at the last senior leadership team, Norma presented a very helpful brief in terms of what's really required going forward for the future and that future vision. And the main ask on certainly 3 key partners was to go away and consider a funding request of 15k each year for 3 years. There's certainly been one firm confirmation from the NHS in terms of the positive offer, and I know that SOS and the Council are considering the same through their own decision-making channels. So it certainly helped move things in the right direction, and thanks to Norma for her clarity on the paper, and it was very well received. Secondly, there was a request from the board to take back to the leadership team a discussion around young people, 10,000 voices, etc. And we had a good debate, and Reagan was there from Youth Work Services as well. Part of the challenge at the moment is this transition phase in terms of youth council elections, and the Youth Matter Steering Group, which is mentioned in terms of 2 key individuals moving on to further education, etc., and just the challenges of continuity. And what was agreed, what Jim Brown, as Head of Education, agreed was he would write to the Youth Matter Steering Group and just confirm that the actions would be integrated into the Children's Services Plan, which is appropriate. Reagan facilitated a bit of a discussion about the ladder of youth participation, which was discussed at the board last time round as well, and just stressing that it can take years to build up a shared understanding and relationship to get to the top of the ladder, if you like, but that services should at least be trying to aim for perhaps the midpoint in the ladder in terms of that shared engagement. And I think the preference was from Youth Work, and we spoke about perhaps having a direct focus group that would link to the board, but there's a lot of commitments placed on young people and the youth council structure, and maybe just a little more informal but more regular check-ins to listen to the key issues that are coming up on the ground rather than something maybe more formal. That seemed to be the best way forward that was suggested. In the appendix, there was also a request to get some information on the recent SOS workshop on the retrofit for the housing stock, so that's in there for interest. New membership update in terms of John Cairns taking over as the temporary Chief Superintendent, so we'll welcome John on board, and Jim McMillan is going to sit on the senior leadership team, and had a positive meeting with him earlier this week. And again, just for interest, the National Community Plan and Network meeting, a number of interesting areas there that came up at the board recently, some further detail on the Verity House agreement. We've fed into the National Suicide Prevention Strategy, going back probably 12 months plus. And then just reinforcing the importance on the horizon about community wealth building and the role of community planning, which I think reaffirms the importance of having it in our action plan. So that's the key points I would like to highlight.
That's really helpful. Thanks, Stephen. And I think certainly just looking at that youth involvement and the ladder of youth, it has been reflected to us from quite a lot of youth leaders that they are quite snowed under with some commitments, and their time is precious, as you say, particularly around exam time, what have you. So I think that informal setting for them might be quite useful, and not too burdensome, hopefully, but that's really helpful. Members, John?
Yeah, just a couple of points. I think the first one, just following on from the Youth Matter, youth Obviously, there was a celebration just last week with bringing the youth together under 10,000 Voices and the lottery, but actually celebrating the rich diversity and the celebration, I think, something we don't do particularly often, but maybe we should, looking at the various projects that the youth of Dumfries and Galloway involved in, and there was a huge, diverse presence last week, so that was really good. Just to wish all the candidates in the youth elections success and a good campaign. But going back to community transport, I think that's a real fundamental step forward, and I think no small feat on Norma's behalf in persistence, and I really welcome the fact that colleagues from NHS have already come forward and committed to that piece of funding. Can I just ask, when colleagues from SOCI and indeed the local authority, what the timeline might look like for their decision making on this? Because I think community transport is a key factor, and it has been a fundamental discussion in community planning discussions for quite a while. And that could we then get something back to the next community planning meeting just for confirmation where we are with it, please?
Stephen, I'll come to you first, and then perhaps Russell will want to, or Rob, actually.
No, thanks, Chair. So I know it's sitting at it's been submitted to the very top in terms of the Chief Exec for consideration, so I'd be hopeful we'll be able to get some confirmation back, if it's not this side of Christmas, then early in the new year.
Rob?
Thank you, Gail. Yeah, to advise, similarly, the request has been put up to match partners' commitments, and we anticipate having a decision by the end of January.
Thanks very much for that. Any other members? No. Okay, so we've considered the updates provided at paras 3.1 to 3.6 as detailed in the appendices. Moving on to item 9, Stephen, you again, risk register.
Thank you. This is the 6-monthly review of the risk register, and the senior leadership team looked at this last month. The feeling was the narrative's been updated in terms of where we are in terms of implementing the new model, but concerns over financial pressures facing the sector across the piece in 2024, and uncertainty in terms of what that might look like and impacts on partnership working. So the recommendation was that the risk rating stays as it is at the moment, and we just keep a watching brief over that in terms of how things develop.
Yeah, I think that's a pragmatic approach, to say the least. Any questions on the risk register? Not seeing anybody. Okay, so we've considered the updated register, and as you say, we'll keep the risk as is. Thank you. Item 10, forward plan arrangements. Stephen, over to you again.
Okay, thank you, Chair. So we've now got dates set for the Community Planning Board 4 meetings for next year. Diaries get filled very, very quickly, so it's not easy with multiple commitments to try and get these dates. What we've done is we've booked the hall here for those 4 dates, just to make sure that we've got a definitive venue, but it might be that a partner might wish to offer hosting a board meeting, and we're open to that, and if any partners are interested, they can let me know. We'll have 6 meetings of the senior leadership team, and we've tried to schedule those out as best we can, and that's a rotating chair arrangement on a 6-monthly basis to share the workload across partners and also the leadership of that. And then for our first meeting in March, it's proposed a theme discussion around children's rights and workforce summit, but also if we can get a paper on housing and the key issues, I can add that to the list that's there as well. Thank you.
No, that's perfect. And I think we're struggling to get the bridge on occasion now. It seems to have suddenly become very busy, which is great for the bridge, absolutely brilliant. But we did have a few tech issues there as well. And I think if we're continuing with hybrids, we need to be in a place that gives us that absolute certainty of sound and connectivity. Valerie?
Certainly, we've got quite a good hybrid meeting room in Mountain Hall, so I can maybe link with Stephen to see if that might be a suitable option if the council's not available, because obviously there's lots of tech that's needed to support it, but in principle very happy to look at that with Stephen.
Yeah.
So
Yeah, Stephen can liaise with you. That'd be perfect. Any other members? John?
Thanks, Gail. I'm just wondering, we had a very informative presentation from Penny as ADP chair,
Yeah.
and I'm wondering if we could give consideration potentially for the new chair of the Poverty and Equalities. I think that the length and breadth of their work across our communities, I think it might be really key for us to hear from them direct to at some point how we can plan that in. That's really over to yourselves, but I think it might be a good idea to do.
Yeah, I think that would be an excellent idea. I've met with him recently, actually. We had a really constructive meeting, and it was great to hear the work that he's doing and what his aspirations are new into the role. So, yeah, we can add that in at some point. Any other member? Valerie?
sorry, I was just a bit thoughtful, and it's going back a wee bit in the agenda, but the food sharing report that was given as part of the LOIP, because it was built in as the locality plan, and that was a really interesting report to read and a really important report. And I guess I'm just there's the Good Food Nation legislation and the requirements that's going to put on public bodies in relation to that. So I guess I'm just thoughtful that's maybe something we don't want to lose reporting on, given it was part of the LOIP. So I don't know, maybe if that's something the leadership team could look at, because I think there's a danger we don't give that the focus, and there's some really great stuff going on in there. Thanks.
No, I think that's a very valid point, Valerie. So we can get it on the agenda for the January meeting and just discuss how we do that. But I think there's the approaches are embedded there, the networks are embedded, but yeah, capturing that continued information and evidence would be really helpful.
No other members indicating they want to come in at this stage, so we've considered and agreed the proposed meeting dates and arrangements and some additional business for future meetings, which is really good. And we'll leave Stephen to arrange a venue with appropriate tech, I suppose, is the key thing. So that's great. Thank you very much. So I don't have any further business, but I'd very much like to thank Norma for her incredible hard work and support and tenacity and drive. And you've brought a lot of passion to this board, and very much appreciated. I know that our colleagues rate the work that you've done incredibly highly, and you'll be sorely missed in Dumfries and Galloway. But I really do genuinely wish you all the best. And I still don't believe that you're actually going to retire, but you keep telling me you are. So. But no, just to extend our thanks from the board to you as well. Very much appreciated. So have an enjoyable weekend all. Keep cosy. Thank you very much.
Thanks, Chair. Bye.